Yeah, and then when you talk about like a different, like maybe this person had a better experience with someone else or vice versa, it goes kind of back to, I think, experience. And we're in a space right now where experience is changing a lot, I guess, in this space,
Mhm.
possibly because of the AI. Um, are you guys using AI, for, I know some people are using it for like note taking. Is there other ways like for communication? What does that look like nowadays when there's so much AI as well, where we're getting people to probably go and use AI than actually reaching out to a real person? I think there's so many different ways we really can kind of dig this conversation. But if we can kind of just start, where are you guys at the AI space?
Okay, absolutely. First of all, I'd like to, define AI in terms of what it means to me, what it means to our organization. We
Mhm.
prefer to look at AI as augmented intelligence, not artificial intelligence.
Okay.
With the idea that it is a way to enhance our abilities and our skills. It's a way to help. It's another tool. It's not something to replace. So we are, like you said, we're using it in terms of documentation. We're just getting into that. I myself
Mhm.
have been piloting that use of AI for the past year or so now to help with documentation. But also we are, starting to learn how to use AI to analyze data. How can we use AI to get people to services quicker? How can we use AI to help with, reviewing records and pulling out the really necessary information so that, we can get people the help that they need. Whether it's in terms of helping us make treatment decisions, or maybe even helping us get payers to approve treatment.
I love that.
That's another use case. We're also learning how to use AI for education purposes. How can we supplement our educational offerings both to our staff and to our clients, to our patients, by helping AI that can aggregate information and help source information so that we can provide better educational offerings.
Mhm.
There are many ways that
I love
AI
that.
can be used
Yeah.
to enhance, to augment,
Augment. No, I like that too, and I love that you put it that way because it really kind of shows why it does matter, right? And in reality,
Mhm.
and I love how you guys are thinking about it and really allowing AI allow you to be more human with a patient. I think all these different things you're talking about allow you to just be really in tune with what that experience looks like. Because let's be honest, I think that's one of the biggest things people also hate about visiting a doctor, right? Is that experience that you have. It's not what it used to be, where it was that family doctor that knew about who truly I was. And even for myself, I think I had a visit recently, and I thought to myself that this lady did not know anything about me. And when I actually said, "Hey, you met my wife last week," and she's just like agreeing, and I'm thinking like, "Oh, you're having a conversation," because that's who I am. To find out that wasn't even the same doctor. She was just saying yes because she was just kind of going with the motion, right? Asking the questions.
Mhm.
But it's the experience. How did I feel now that that lady really wasn't authentically being herself? Not because she didn't want to,
Right. Yep.
but ideally it's just kind of the system that it plays. And I think with a lot of this augmentation, as you mentioned, we could really do more of the things that we love and let a lot of these repetitive tasks and the smartness behind it all, really, when you get to feed it. What is one of the biggest things you learned about AI and how to use AI? Because I think that's where people also have this fear, is like they just don't even know where to start.
Yeah. Yeah. I mean, even just with that documentation piece, I mean, by allowing, the AI to worry about the documentation piece, I can focus on you, the patient. I'm not sitting here typing on my screen or writing notes. I'm listening to you and, hearing you and remembering who you are, remembering that I met your wife, rather than,
Yeah.
just typing it away and forgetting about it.
I love that. No, it's definitely a game changer. I'm enjoying it. I was one of those that my friend told me about AI, ChatGPT years ago. And to me, it was like anything else, like, all right, whatever. And then maybe the last 2 years really tapped into it. And I'm like, wow, what a game changer. And
Mm.
now understanding the conversation more, seeing when people don't use it, there's still people that do not use AI. Like my mom, I was telling her one day about ChatGPT. I said, "Mom, do you use ChatGPT?" And she's like, "What?" And I say it again, and she's like, "What is that?" I'm like, "Just never mind." Like, and not that they don't use AI. Everyone's using AI because it's on their phones. They
Oh,
just
yeah.
don't see it as
Yeah.
AI.
You just don't know
Um,
it. Yep.
hell, when you talk to, I have a friend. I don't know if you're, maybe your house is like this, Doctor. You have Amazon and Siri all around the house. Alexa, actually, is what it is. Alexa.
Yeah. Yeah.
I go to my friend's house and he'd be like, "Alexa, turn the light green," or "Alexa, turn this on." And I'm like, "Oh my God, that is AI at its finest," you
Mhm.
know? I'm not there. Yeah, I'm not there. Do you have that at your house?
I have a little bit of it. In fact, I was on vacation recently away from those things, and I was just joking with my partner and, saying out loud, Alexa, what's the weather today? And she would laugh.
That is funny. No, man, so many people really just live off of that. That is hilarious. What do you say to young clinicians who are kind of burnt out before they even begin? I think that's also something that's been kind of going around.
hmm Well, I think it's important to just, first of all, remember remember why you're doing what you're doing, right? I mean, yeah, it
Right.
can be very easy to get burnt out by all the peripheral stuff, the red tape, the policies, et cetera. Remember why you're doing what you're doing and who you're doing it for. You're doing it for your patients, right? First of all, because you want to help, and then you're doing it for yourself for that satisfaction of making that connection and helping people. Altruism is not pure in the sense that you're not purely doing it for somebody else. You're doing it because it makes you feel good,
Yeah.
also. And yeah, I think it's important to stay grounded. Why are you doing what you're doing? Start with that,
Right.
and that is never going to change.